This green and yellow pack is on every DCA and RRV. These packs contain 3 water-repellent Tyvek suits, which are water repellent for up to an hour and a half, 2 FFP3 masks, 2 surgical masks, 4 surgical masks with visor, 2 pairs of safety glasses, 4 pairs of sleeve protectors, 4 pairs of overshoes, 4 hair covers, 1 pair of heavy-duty gloves, 2 aprons, clinical waste bag and tie, and also a laundry bag. This pack can be used for the high-risk cases where there are symptoms of a viral infection, which could include sore throat, headache, red eyes, hiccups, joint and muscle aches and pains, weakness, chest pain, rash, difficulty breathing and swallowing. Removal of PPE. Removal of Level 2 and Level 3 PPE is the same principle. Here we are showing the removal of Level 2 PPE. It's very important to remove PPE carefully and in a way so that the contaminated PPE is not allowed to contaminate any other area or the person wearing it. First, a clean officer needs to set up the scene. This needs to be in a safe environment such as outside the patient's address, outside A&E, or outside the back of an ambulance. For a crew to disrobe, you will need 6 clinical heavy-duty large waste bags to make 2 double bags, a single bag in the middle, and a spare. Remove an ample stock of gloves for each member of staff of the correct size from their boxes and place in the middle for easy reach. The officer then needs to stand back and follow the relevant action card for disrobing. This begins with a welfare check. First, remove the sleeve protectors and outer gloves and place in the center clinical waste bag. Put on a clean second pair of gloves. Remove the apron. This process is the same for all levels of PPE where an apron is worn. Hold the neck strap close to the back of your neck. Break the strap and fold the top of the apron down. Break the back straps and fold the apron forwards in on itself. Roll up the apron, only touching the inner side, which is clean, and dispose in the middle clinical waste bag. Change the outer layer of gloves for a clean outer pair. Then, prepare to remove the face protection mask. You can help each other do this. If you are wearing goggles or protective glasses, remove them first. Close your eyes and tilt your head forward. Untie the straps at the back of the head. Take the mask forward, ensuring your hands don't touch any part of your face. Lower the mask into the middle clinical waste bag. If you are then helping a crewmate remove their mask, make sure you change your outer pair of gloves again before doing so, as your gloves will be contaminated from your mask. Make sure the clinical waste is securely inside the middle bag. Replace your outer gloves once again. Don't worry about the amount of gloves you're using. It's better to be safe than sorry. To remove your overall, with a clean pair of outer gloves on, undo the top part of the zip to halfway down the chest. Tilt your head forward. Pinch the hood and turn it backwards and inside out part way across your head to expose the clean inside of the hood. Once again, change your outer gloves and replace with another clean pair. Then step into the double bag. Roll down the hood, only touching the inside of the overall. Continue to roll down the overall, down to your knees. Continue to ensure you only touch the inside. Roll down the rest of the overall. If both your pairs of gloves have come off at this point, put on one pair before continuing. Take off the boot covers and step out of the bag. Make sure all the waste is inside the bag. Roll the bag up. Dispose of the middle bag by putting it inside one of the other bags. And then change your gloves again to bag up all three. With clean gloves, seal and tag the bags and put everything into your spare sixth bag. Tag and label this bag as contaminated and highly infectious waste. Remove your gloves. If soap and water is available, wash your hands thoroughly, otherwise use vehicle wipes and alcohol gel. Remember, at all times, never touch your face or anything inside your protective clothing. Remember, double glove. Changing the top pair of gloves on a regular basis so as not to contaminate areas. Use hand hygiene as often as you possibly can.